VISTA's return on investment at the Veterans Administration. The purpose of this project is to evaluate the return on investment, ROI, of VISTA's implementation in an organization such as the Veterans Administration. ROI evaluation is useful for determining the monetary benefits of investments in technology, in hopes that an overall reduction in expenditures and/or an increase in revenues is present. VISTA is an IT program that is used as the VA's electronic health record system, which has been implemented in 128 VA establishments. It is primarily used for the delivery of vital hospital information, including data such as EHRs and imaging systems. It is estimated that by 2008, there will be 5.8 million participants in the VISTA system. For this evaluation, the following components were compared for return on investment. They were IT costs, number of prevented cases, and IT expenditures. We found the data from the fiscal year 2008 budget estimate of the VA. The variables we chose were IT costs, prevented cases, and IT expenditures. IT costs and expenditures were provided in the website, however, prevented cases had to be projected. Total number of patients for years 2006 through 2008 were provided. It was projected that 88% of heart disease and cancer diagnosis would be prevented for these totals. The number of total prevented cases was calculated by determining 88% of the total number of patients. We looked at two correlations to determine if spending more money on IT would increase the number of prevented cases and decrease the total expenditures of the treatment of these cases. This was found in Excel by multiplying the correlation between IT costs and prevented cases times the correlation between prevented cases and IT expenditures minus the correlation between IT costs and IT expenditures. For the second, we determined that if there was a lower number of IT expenditures, then it would increase the amount that can be spent on IT, which will further increase the number of prevented cases. The calculation was similar. Here are our results. This table shows the collected data for 2006 through 2008. This graph shows a positive correlation between IT costs and prevented cases. This table shows the calculated correlations from Excel among the three variables. The equations were then used to calculate the overall correlation between IT costs and IT expenditures and prevented cases. Because of the positive correlation, both statements are true. This evaluation shows that there is a strong correlation between IT costs and prevented cases. This shows that if money is invested in IT, then this will essentially increase the number of prevented cases, which will decrease the overall expenditures on treating such cases. The VA's ROI will benefit because VISTA will signal necessary interventions of care to prevent the total number of diseases.